All right, let's jump right in. In medical research, having a great question is just the start. To actually get a solid answer, you need the perfect statistical tool. Think of it like a surgeon's toolkit, right? You're not going to use a scalpel when what you really need is forceps. Today, we're building that essential toolkit for comparing groups. So you've got your goal. You want to know if a new treatment actually works, but which analysis is going to tell you the real story? See, picking the wrong test can, and often does, lead to some really misleading conclusions. So what we're going to do here is give you a clear roadmap to navigate 5 of these key statistical tests. That way, you can make sure your analysis is as sharp as your research. We're going to start with the foundation, the absolute basics. This is pretty much the first and most fundamental tool you'll reach for when you want to compare several different groups all at once. Okay, let's picture a classic clinical trial. We've got 3 totally separate, independent groups of patients. The first group gets our shiny new drug, the second gets the old standard drug, and the third group gets a placebo. The question is super simple. Is there any difference in headache relief among these 3 groups? And this is where the one-way Anova comes in. It's the perfect tool for this job. If you already know how a t-test works for comparing 2 groups, just think of this as its more powerful sibling, built specifically for 3 or more. It gives us one single overall p-value that tells us if there's a significant difference somewhere among our groups. So here's what our data looks like. It's really straightforward. We have one independent variable, which we call a factor, and that's the treatment group. And this one factor has 3 different levels: the new drug, the standard drug, and the placebo. And for each of those, we're measuring one thing: the average headache score. So the takeaway here is super simple. You're going to grab a one-way Anova when your research has this exact setup. One factor, broken into 3 or more separate groups, and you're just comparing their average scores. Easy as that. But, research is rarely that simple, right? Biology is messy, and there are often multiple things going on at once. So let's add another layer of complexity to our analysis. A really sharp researcher is going to ask the next question. That's great, but does our new drug work the same for men and for women? Now, all of a sudden, we're not just looking at the treatment. We've brought in a second independent variable we have to think about: the sex of the patient. This new question calls for a two-way Anova. This lets us look at the effect of the drug, and we can look at the effect of sex on the headache scores. But, and this is where its real power is, it also tests for an interaction. Now, an interaction tells us if the 2 factors work together in some unique way. For example, maybe the new drug is a miracle for women, but does absolutely nothing for men. That's an interaction. You can see the data isn't just a simple list anymore. It's more like a grid, right? We've got our 3 treatments going across the columns and our 2 sexes down the rows. Every single cell in this grid is a unique combination, like, say, females who are receiving the new drug. So, when do you pull this tool out? You'll want a two-way Anova anytime you have 2 factors in play. It's the only way you can really untangle the main effects, that's the overall impact of the treatment and the overall impact of sex, from that really crucial interaction effect, where the combination of the 2 tells the real story. Okay, so up until now, we've been comparing different groups of people to each other. But what if you want to track changes within the same exact people over a period of time? Well, that's a whole different kind of question, and it needs a whole different tool. Let's switch up our migraine study again. This time, we're not comparing different groups. We're taking one group of patients, and we're going to measure their headache scores every single week for 5 weeks while they're on the treatment. The key here, and this is crucial, is that we're tracking the same individuals over and over. This is the perfect job for a repeated measures Anova. It's designed specifically for these within-subject studies. You can think of it like a paired t-test, but on steroids, because it can handle way more than just 2 points in time. Its real strength is that every person acts as their own control, which can make the analysis incredibly powerful. This timeline shows the setup perfectly. See, we have 5 data points, but they're not from 5 different groups of people. Nope, they're 5 measurements, all tied back to the same set of individuals. We're looking at the change within each person as they go from their baseline all the way through the treatment. Life and data are both pretty messy. Sometimes an outside variable, something you're not even testing, can completely muddy your results. So now let's look at a tool that helps us clean up that noise so we can see the true signal underneath. Let's go back to our first drug trial. Imagine this. You run your one-way Anova, you're all excited for the results, and nothing. No significant effect. Bummer. But before you throw in the towel, you wonder, what if something else is going on? We all know stress can trigger headaches. What if, just by random chance, the people in our placebo group happen to have way lower stress levels? This confounding variable could be totally hiding our drug's real benefit. And this is what that disappointing result looks like. You can see the bars, they're all kind of hanging out together, they're pretty close. And our p-value of 0.15 is way above that magic 0.05 number. So, based on this, we'd have to conclude our drug doesn't work. But is that really the whole story? And this is where Ancova comes to the rescue. It's this brilliant hybrid of Anova and regression. It lets us do our Anova, but at the same time, it controls for a continuous variable, which we call a covariate. In our case, that's the patient's stress level. It basically, statistically, removes the effect of stress from the equation so we can see what's left. And wow, look at the difference. After Ancova adjusts for those baseline stress levels, the true picture just pops right out. The new drug group now has a way lower headache score, and our p-value is a nice significant 0.02. We've literally rescued our study just by controlling for that one confounding variable. All right, now for our last tool, and maybe the most flexible one of all. Let's get real for a second. Research almost never goes perfectly. Patients miss appointments, data gets lost. We need a method that can actually handle the inevitable messiness of real-world studies. Hey, remember our 5-week repeated measure study? It's a great design, but it has a potentially fatal flaw. A traditional repeated measures Anova requires complete data. So if a patient gives you data for weeks 1, 2, 3, and 4, but misses their week 5 appointment, their entire dataset gets thrown out, just gone. That is a massive waste of information and statistical power. This is where mixed models really shine. They are just so much more flexible because, and this is the most important part, they can handle those missing data points. They use all the information a patient gives you. They can also handle measurements that are unevenly spaced and much more complex data structures, like, say, students who are inside different classrooms or patients who are in different hospitals. Phew, okay, we have covered a lot of ground. So let's pull everything together into one simple, quick reference guide that basically summarizes our entire statistical toolkit. In the end, it really all boils down to your research question and the structure of your data. If you're just comparing 3 or more independent groups on one factor, that's a one-way Anova. Got 2 factors? You're using a 2-way Anova. Tracking the same exact people over time? That's repeated measures. Need to control for some continuous nuisance variable? That's a job for Ancova. And for all that messy, complex, or incomplete longitudinal data, the super flexible mixed model is going to be your best friend. See, by choosing the right tool, you move way beyond just getting a p-value. You actually start to tell a more accurate, a more nuanced, and a much more powerful story with your data. So the next time you design a study, you have to ask yourself, which one of these tools is going to let my data tell its absolute fullest story?